Hello, my name is Dylan Hoffman, and this is a presentation on upper cervical stability testing. Why would we do upper cervical stability testing? There are several ligaments that are vital to the stability of the upper cervical spine. Cervical instability can be caused by either trauma to these ligaments, some inflammatory conditions, or other congenital conditions can contribute to instability in this area as well. Any patient that has cervical instability is an absolute contraindication and should not receive cervical mobilization or manipulation treatments. If we're going to perform these interventions, it's important to first test for cervical instability on a patient. Here are a couple of special tests that can be done to assess for upper cervical instability. The first is the alar ligament test. This assesses stability in the frontal plane, can be performed by the patient sitting or supine. The patient will palpate the lateral aspect of the C2 spinous process while laterally side bending the head. A positive test is seen if the spinous process does not immediately move in the opposite direction. We can see a torn alar ligament here. Let's look at this test being performed. To test for injury to the alar ligament, we're going to first find the spinous process of C2. We're going to go just below the occiput. We're going to flex, and we should feel that spinous process of C2 pushing out. We're then going to palpate with one finger on each side on the lateral aspects of that spinous process, then side bend the patient's head. A normal test is that when we side bend, we will feel the spinous process push in the opposite direction of the side bend. The sharp purser test is a test designed to assess the stability of the upper cervical spine, specifically at C1, C2 at the transverse ligament. To perform this, a patient will be seated with his head slightly flexed. The clinician will then stabilize the C2 spinous process and apply a gentle posterior force to the head. A positive sign is found if there's a click or clunk noted and/or the patient feels reduction of symptoms. Let's see this test being performed. The sharp purser test is performed to assess the transverse ligament. To do it, we will first have the patient slightly flex the cervical spine and palpate the spinous process of C2 with our thumb. We will then apply a posterior pressure to assess for any clicking or loud noises associated with a tear or in a reduction of symptoms. The sagittal plane stability test is another test that assesses the transverse ligament. To perform this, the patient would be supine. The clinician will then palpate the spinous process of C2 while moving the occiput slightly anteriorly. A positive sign is if the C2 does not immediately follow the translation of the occiput anteriorly and/or if symptoms occur. The sagittal plane stability test is another test to assess the transverse ligament. It's performed by first using one index finger to palpate the spinous process of C2. You will then put your hands on the occiput and provide a slight anterior translation. A positive test is seen if the C2 spinous process does not follow or there is production of neurological symptoms and/or pain. As mentioned before, screening for upper cervical instability is extremely important prior to applying manual therapy manipulation to the cervical spine. We see in literature that there's a prevalence rate of about 0.6% of upper cervical instability from a number of reasons, primarily through arthritic and other inflammatory conditions and some congenital conditions such as Down syndrome or Marfan syndrome. In addition to an upper cervical instability screening, we need to screen for range of motion, motor neuron testing such as Babinski's, and VPI to ensure that the patient is ready to receive a manipulation to the cervical spine. Thank you.